government, that I'm hopeful that this will become more part of, as Todd was saying, healthcare, not integrative, alternative, but it will be our healthcare system based on wellness and prevention. And if I can say that there's a lot of talk also about putting in a whole new level of coaching for behavioral change that's going on in healthcare, and they're on a national level looking on how to make that happen. So I think it's an agenda that's coming. For those patients in the immediate, it's frustrating.
I think too, it's disheartening based on that, because I practice family and sports medicine. I'm a nurse practitioner. And I find that now I think the healthcare climate is at a point where we're positioned with the new healthcare, the emergence of the new healthcare plan. We're at a point now where if we do start educating our practitioners and we carry that through, we don't drop the ball and maintain that throughout, I think there will be a climate of understanding that we will develop a better prepared healthcare practitioner that understands and is not threatened, and insurance companies will appeal more to the valid modalities that are helpful to patients, as well as testing.
But one part of your question I think is particularly key, which is how do you deal with your patients, or how do you deal with consumers to get them to engage and get them to value some of what insurance may not cover?
So,
On a one-on-one basis.
well, I would also go back to nursing again. That if nurses at the bedside in the communities, nurse practitioners, everybody is also educated in wellness and prevention strategies and in the coaching model where you support people on behavioral lifestyle changes toward wellness, I think that it could be added to the role of the practitioner, physicians, nurses, anyone working in healthcare, and that it doesn't always have to be a separate referral that's not paid for. So I think it's the education moving forward, and I think it's also in the system as it is now, the importance of continuing education and supporting practitioners to learn new skills. And it really starts with themselves, because everybody working in the healthcare model is pretty burnt out. And I think that if I could just say a little bit more about that most of in holistic nursing and in holistic medicine, it begins with self-care. And if you begin to take care of your staff wherever you are, in whatever setting, the return is so much greater, both in their presence and their being able to not be sick on the job. It costs $80,000 every time a nurse leaves the university, the hospital, and they have to be retrained. That's a tremendous, if we're talking about cost, if we could keep the nurses happy by caring about them, less medication errors, it goes on, and it's great PR, and nurses want to work here and patients want to come back. And I think it's a missing piece in healthcare to not be looking at this as a very basic in-service for helping the people who are caring for others care for themselves.
Another question. Down front. Oh, sorry. I have a microphone coming for you. Because you want to, unless you might be able to project.
No, I don't project very well. Actually, I have a comment rather than a question. And I'm listening to this discussion, and it makes me think that another obligation that those of you who practice integrative medicine have is to be able to get the results of valid research into the popular media, into the daily newspaper, the magazines that people read, and valid research, because we've all read a lot of the reports of studies that you look at it and you laugh and say, this is ridiculous. But the valid research will help to change the mindset of people who are trying to do in the new healthcare plan, as well as perhaps some of the insurance companies.
I would just have to agree, and I think with that, the education and looking at how we could disseminate some of the good research and good data, because when you look at integrative healthcare as it's practiced, as I mentioned earlier, it's very inquiry-driven and continually inquiry-driven based on study and successive studies and reproduction of studies and data. And as a practitioner now, that's how I was socialized into integrative healthcare, and I think we should continue that.
These have been great questions. And yes?
I project pretty well. I'm Noelle, a nurse practitioner, recent graduate of the DNP program here. And my question is, do you see a challenge in the future for funding for this research that we're talking about? I see funding coming from industry, pharmaceutical and other types of industries, from the government and from private corporations. Okay, and from private corporations, Bill and Melinda Gates Foundation, Robert Wood Johnson, and other foundations. In order to get this evidence that we need, does nursing need to re-examine our criteria for what is good evidence? For a long time, we've been following the medical model of good evidence, and since we're talking about healthcare and not necessarily integrated healthcare anymore, should we look at that again? That's my question.
Well, I think that nursing and nursing research is very unique. And nursing research is also always built on qualitative research, not just quantitative, where we have an intervention and we look at the lab data. But a lot of it is, and I think it's what Maria alluded to earlier, is the quality of life issues and how people feel. And most of these modalities are non-invasive, they're non-life-threatening, and they need to also have the kind of research that would validate the benefits. And some of that also has to do with quality of life surveys that we give the patient. And I also know that the other kind of evidence-based research is certainly growing. There was a recent, the IOM did another summit that looked at, I think it was 6,600 studies. And out of those 6,600 studies, there were 9 modalities that came out of that, with hundreds of good research, both on the efficacy and on the cost effectiveness. So I think going back to the earlier question about how does the media start to pick up on this, rather than on one vitamin supplement that never killed anybody but makes it to, you know, the popular news media. And I think that there is a very important need in health policy and health media outlets to really start to support this, because once it's ingrained in the popular culture, it's going to then move to the next level of acceptance and reimbursement and whatever else we need to do.
Yes, in the corner. Does he have the microphone?
I think I project pretty well as well.
Okay.
But I'll wait on the mic.
Oh, yeah, we have people next door out here, so we're not alone.
Okay. I want to apologize for my tardy arrival. This is a magnificent panel, and I want to thank you. I am an epidemiologist, and I think one of the pieces that is so necessary, I agree with exactly what you said, complementary treatment, therapies, modalities, whatever you want to call it, the integrative nature of what it is we are talking about, and creating atmospheres for research to go out further is going to take us to be multidisciplinary in our research. We got to have an epidemiologist. I use nursing research all the time in order to sort of nudge epidemiology to say, hey, you guys are late on this. Nursing's been doing this work all along. Influences on religiosity and spirituality and health outcomes. You guys have been at the forefront of that. Epi is a little slow on that. So I would recommend and certainly present myself as someone who is very, very interested in finding out how we can work together and really be complementary in our approach to research and our approach to media and how we deal with media and what the difference between good research and the other stuff that often gets published as well. And to the untrained eye may look like a great idea, but to us, we have to do more to be more inclusive in our discussions, and that's all I had to say.
So do we feel that the paradigm is changing in what healthcare, what are the components of healthcare? I know, Maria, you're a Reiki master, and there was something that led you to seek that out, you know, and
It was-
probably had some results from that.
It led me because with Reiki, at that time in 1985, there was one of the only, I think it was the only modality aside from acupuncture that dealt with the energy system of the body. The acupuncture deals with the meridians, and when you get an acupuncture treatment, you go to the meridians, and the meridians get blocked so the chi or life energy flows through the body. Now you have acupressure, that's what Janet Knopfler is going to be teaching, and which is really not invasive. Acupuncture has the needle, so it could be kind of invasive for some individuals. So I went to Reiki because it's a healing touch, but what it does, it moves the energy to balance the energy around the body, unblocking stagnant chi or life energy. As a Reiki master, I don't heal. I am just a channel of that healing energy, that it's the person who heals himself. That's why it's so important to be to use mindfulness and be in the moment to make it happen. Because, like I repeat again, the mind is a very powerful.
I'd just like to elaborate a little on what Marie is speaking to. Energy therapies have been around culturally throughout the world for millennia, and what we're learning here in the West really comes from those traditions. Some of it may not be evidence, it's energy-based, but it may not be evidence-based because we haven't yet found the container or the vehicle in order to measure it. And we get caught sometimes in our Western paradigm that we think if we can't understand it, it's not valid. And I think that this is still for us to kind of be humble to the systems that have existed and have been effective around the world. And in energy field work, I remember back in the 70s living in New York that the doctoral program at NYU Medical Center was doing research on something called therapeutic touch and demonstrating that energy was not contained only in the physical body but extended outward. And that was very early in this culture to have taken that on, and I have to say nursing really challenged the existing paradigm, and I think has been part of it, along with Nixon going to China at about that time and learning about acupuncture. But we're very early on in learning and understanding the possibilities that exist. And I think we're only going to see energy medicine, energy field theory grow with research as we learn more.
I would agree with that. Yes.
Thank you. I'm Kathleen Daly, nurse practitioner. I'm just thinking back through a lot of thoughts here. One is with regard to the meridians and energy fields and these types of